we had to hit the ground running. So there was no honeymoon period, to address this issue in a leisurely manner.
So he called together all the partners working with the government for over a period of 3 months. We sat together to analyze, to look at what the issues were that was responsible for that poor coverage.
They identify the caregivers, identify the children under 5, look at their immunization status, and refer them to the health facilities.
So the South, we had to go zonally. Lessons we have learned from the North, that's the NTLC, for over a decade, has helped us to fine-tune the processes.
Instead of the pressure to be on the Abuja hub, we're going to have other entry points.
Construction work on the vaccine hubs has commenced, and they are expected to come on stream by 2025.
Today, I can confidently beat my chest and said, yes, coming of NAMCHIC has really improved our indicators.
Since its inception, the National Emergency Maternal and Child Health Intervention Center, NEMCHIC, in collaboration with the BHCPF, has trained and deployed over 3,000 midwives through the Reach Every Ward with Skilled Birth Attendants (REUSBA) strategy, thereby increasing the availability of SBAs at the PHC facilities from 43 to 51%. Additional midwives and community health extension workers, CHEWs, are being recruited through the Expanded Midwives Service Scheme to be deployed to the PHCs across the country. Because the actual mandate of the primary health care lies with the states, the agency prioritizes the support it can provide them to ensure increased delivery on its all-important mandate. In collaboration with its partners, the agency identified significant gaps in the capacity of the states and local governments to fulfill this core mandate. To address these gaps, the Technical Support Program, TSP, was developed. The objective of the program being to determine the technical assistance, TA, needs of the states and prioritize response to these needs. Operationally, states make requests for technical assistance, and the Technical Assistance Desk, in turn, identifies the appropriate department or personnel in the agency with the requisite expertise to provide the needed assistance.
We help them set up their governance structure, their law, their repositioning. Then we try and be an interface between the State Primary Care Development Agency, local government health authorities, and some partners to get in the required technical support within the agency in a consolidated and documented fashion. And this one is not a situation whereby we just go and deliver anything. We involve them in what we do, and at the end of the day, we ask for their opinion, like feedback.
To date, the Technical Support Program, TSP, has delivered several targeted on-site technical assistance to 29 states since inception. The role of the states in the delivery of primary health care in Nigeria is a very critical one, but leading up to 2017, the states had felt overlooked, talked down to, and not treated as critical partners. For the new management of the agency, this needed to change if they were to achieve the turnaround they desired in the performance of the agency.
With the coming of the ED, there were a lot of innovations to smoothen the relationship between the state and the national, because we cannot get optimum results from the state or at the national level when the relationship is not very cordial. When he came on board, we introduced what we call the quarterly meeting between the state executive secretaries and the ED of National Primary Care and his management team. And the essence of this meeting is to brainstorm on the happenings around the activities, the core activity of primary care, at the sub-national level and at the local government level, up to the world level. It's also an opportunity for peer learning because states are expected to make presentation to executive director, and also equally the National Primary Economic Agency make presentation on our activity with the happenings within the 6 geopolitical zone of the country. And the worst performing states and the best performing states are made to make presentations, while they roll out or share out their strategy on how they're able to achieve results. So best practices are gotten from that meeting. And I think is one way of also interacting with the management at the national level.
And we work very, very collaboratively with them, knowing that they are at the implementation level and they are the people that get the job done. So in terms of delivery, in terms of execution, we've worked very closely with the State Primary Healthcare Board. I'm very, very proud of the work that the executive secretaries, the permanent secretaries, the DGs of the primary healthcare boards are doing, of course, working with the Honorable Commissioners for Health.
Another set of critical stakeholders for the agency are its international partners and donors.
When we first started, right, it was a journey of, or it was a relationship of partners doing what they want to do, coming to the agency with projects, coming to the agency with specific line of funding that they have. Over the years, we've seen that transform to the agency taking leadership in primary healthcare activities in the country. Specifically when Dr. Faisal came on board, right, things changed. The partnership, not that the partnership changed, but partners were held more accountable to deliver on the task or on the funding that they get to support the National Primary Healthcare Development Agency. So instead of the partnership being the partner-led activity or partner-led partnership, partner-led collaboration, because you have the money, it became a government-led partnership.
I would say it's been really inspiring to see how the agency has transformed from your standard government system, civil servants and all of that, to, I'll call it a quasi-government private sector entity where things are done in the business not as usual manner, where results are the focus, not just the process, which sometimes is the challenge with a lot of other places. So where there is impatience to actually make change, where everything is an emergency, just to emphasize the emergencies we actually have in our health system, especially at the primary healthcare level in Nigeria. So for me, it's been challenging. Working with them a lot of times pushes you to the boundaries. It pushes you to the boundaries of, I don't know what I'll call it, like you have to work and work and work, and you'd expect that the government would want to relent at times, but this is the government that does not relent. This is the agency that want results, so they want you over the holidays to be working, where the Christmas break, the end of year break, there are no breaks because we are in an emergency by the agency's standards.
As part of the vision to completely change the PHC story in Nigeria, the agency, in collaboration with partners, developed the PHC Revitalization Plan in 2018. The plan is for a 10-year period spanning 2018 to 2028.
Really, the PHC reimagining was really a culmination of many years of gathering knowledge, experience to understand different strategies globally and then contextualizing it to what's happening in Nigeria. And we're able to work with our donors, our partners, the subnational level, the state LGA level, to now come up with a compelling vision for primary healthcare that makes it possible for us to invest resources in a way that will ensure that we not only achieve universal health coverage by 2030, but we're able to achieve the health components of the Sustainable Development Goals.
That plan resulted in a first of its kind commitment of $3 billion from Gavi and the federal government of Nigeria to strengthen immunization and primary healthcare systems. And that was something that was never heard of, where a sector was able to secure that kind of resource and over that period of time, and get the government, and it's not just the government, but I mean government from the presidency to the Federal Ministry of Finance and all the entities that were involved, the full apparatus of the government to actually sign off to that plan.
The development of the PHC Revitalization Plan led to the agency hosting the PHC Re-envisioning Summit in March 2022, the aim of which was expanding the resource base for primary healthcare in the country through increased private sector participation.
And of recent, we did PHC Summit where we were bold enough, to tell the nation, look, this is where we are. All along, we did not see any deliberate capital investment into primary healthcare. And that was why, the performance has been suboptimal. We went to the extent of developing an information on every facility, at least one facility per political ward. As it is now, we can tell you in a political ward, if you mention political ward, I will tell you the facility, I will tell you the level of damages, and I can tell you how much is required to fix it. So we went to the level to tell the nation, of the 30,000 estimated facilities, this is the situation. These are the needs.
This summit was a collaboration with our donors, our partners, and the private sector. So at the end of the summit, we were able to get commitments from private sector practitioners, high net worth individuals, that they were going to adopt primary healthcare centers. So we have some 774 primary healthcare centers that have been adopted by these high net worth individuals like Aliko Dangote, Mr. Jean Ovia, Ike Imokide. We have Herbert Wigwe, folks that have really demonstrated interest in revitalizing primary healthcare centers in their states and then local government. Then we have some 97 others that have made pledges to revitalize primary healthcare centers. So coming out of that summit, there is clarity around what next we're going to do. This is why we've established a primary healthcare transformation office, where we will now monitor all of the pledges and making sure that that transformation takes place, that people revitalize PHCs, and that we're able to encourage other people to put their money into primary healthcare.
A factor that has played a critical role in the success of the agency's programs is the introduction of the concept of primary healthcare under one roof.
Before that policy was made, programs were run on a parallel basis. There was no coordination. Everybody was just doing what they want to do or what they like. Polio will be running their own. DRF, that's Drug Revolving Fund, will be doing their own things. Then as a disease control will be doing their own things. But with the coming of primary care under one roof, it made every program to be in one roof, under one roof, which means disease control, drug revolving fund, all the other aspects of PHC, other component of PHC should be under one authority, one governance. That is what primary healthcare under one roof, which we are now running in all the 36 states of the Federation.
The upgrading as well as building of Level 2 primary healthcare facilities has commenced across the country and is already impacting communities.
The new facility has brought a lot of good things here. Most of primary healthcare activities are carried out here. The facility has really helped the community and the environment of this area so much.
This place is very good. They take care of person. They give better drugs for this place. I can see that this place is better than the other hospital before I attend. then give us drugs for him. Then load anyone you have. Since I come here yesterday, they load drugs for me, then give me injection. No one I bought from outside. That is why I see that this place is better than the other side.
Critical to the success of the primary health care revitalization is ensuring the availability of qualified manpower in the health facilities.
In a number of places, we are yet to achieve the requisite number of primary healthcare workers, largely because some of the states are not recruiting health workers. It's not about the infrastructure. It's about the human resources. As a matter of fact, I dare say, if you have a nurse who is competent, now this is not the standard, but they can treat in an infrastructure that is not 100% okay. But if you have a state-of-the-art infrastructure and you don't have the nurse that is qualified, then it's useless. So we need to, imbibe that, that understanding, so that the resources should be channeled towards building the right human resources for our healthcare centers.
This has remained a major challenge in the speed with which the PHCs can be made functional. It is the responsibility of the states to recruit and deploy these qualified health personnel to the areas where they are needed. The need for the states to pay particular attention to this area of huge need becomes even more important as we transit into a new era, with a majority of new and some returning governors. The NPHCDA will encourage them to carry out an audit of their primary health care manpower in order to identify those that have the educational qualification and necessary skills for this level of care. The audit is expected to help the states determine the real numbers of available manpower and lead to the recruitment of personnel to close the gaps identified. In some local government areas, the challenge is that of maldistribution of health workers. Urban and peri-urban PHCs tend to attract more health workers, while the rural primary health care centers are left with a deficiency of health workforce. Therefore, the redistribution of these staff, along with incentives to attract workers to the rural areas and address this inequity, becomes necessary. When this is done, it is expected that more PHC facilities will be made functional and their desired impact on primary health care delivery across the nation will be achieved.
By 2016, there was a Gavi audit that put the country very bad position. The conclusion was there were misuses of the resources and so on, and the government was asked to refund. And the government of Nigeria had to pay. So in other words, all the resources Gavi released to Nigeria, including the interest we were generating for them, government had to pay back.
It was clear that urgent steps were needed to transform the agency and move it towards increased efficiency and accountability. This was necessary to improve performance and transparency, both of which were needed to earn back government, citizens, as well as partner and donor trust and confidence. To achieve this, a number of steps were taken by the management. The NPHCDA financial system was revamped and a clear and structured engagement process established to meet international best practices. The International Public Sector Accounting Standard, IPSAS, is currently being implemented by the agency towards greater transparency and accountability in the management of resources.
In fact, that has improved seriously the delivery of financial services, because we tie every financial disbursement to prior work plans of the agency, and budgets that are rolled out, disbursement are tied to them, because since it is software based, you cannot go outside and do anything outside work plans that have been approved. We've implemented all government financial management reforms to the latter, and which means no longer do we have those kind of cash advances granted to individuals, but we have direct payments to beneficiaries through the government payment gateways. Then that will eliminate any form of fraud. We have accounting software that has aided in the performance of financial reporting, redesign processes of financial management. We have in place now financial management capacity building plan, which were drawn together with the partners on how funds should be managed, on how reporting of their funds should be done. The implementation are in phases, short-term phases, and the overall is automation, which we have in place, rolled out together by the donors. So with automation, and there's this timely disbursement, timely reporting.
For the management, technology was to play a vital role in the activities of the agency. As a result, it reorganized the ICT department and invested heavily in both software and hardware to improve the performance of staff at all levels.
From 2017, the management recruited more than 20 ICT officers. We have a very conducive working environment. Like when you enter, if you see the ICT unit, the way it's looking, it wasn't like that before. Well equipped with desktop computers, and everyone has a laptop, and we have a structured and upgraded help desk. The ICT officers now are able to support both staff and other stakeholders that have things to do with the agency. We have most of our applications and systems hosted here. Our server system, we have on-premise server that has been purchased and upgraded, and the ICT officers were trained and are able to host and manage whatever application that we have there. Now, more than half of the agency staff have been issued with laptops to enable them work, whether physically when they're in the office or even outside the office. The internet facility has greatly been upgraded and optimized. We have a GTS that when you're sent on the field, we track whether you're actually in the field and doing what you're sent to do. We have the PHC information system. This is the first of its kind. Upon logging into the system, you'll be able to know the number of PHCs that we have in the country, where they are located, their HR, the personnel in those areas. You will just by a click of a button, you'll be able to get that information.
The agency also developed and deployed EMID, an application that serves as a tool to monitor and keep tabs on the performance of states.
The EMID platform is one platform that I think is an innovation that I think it will go a long way to a kind of support, encourage, and also improve on the system. Because what we do before now is paper reporting. I know these people are bound to miss. These people are bound to be stolen away from the facility and bound to be manipulated. But in the EMID platform, the reporting is real-time reporting. You see your data, what you are doing. If you are improving, you see. If you are not doing well, you see. You can compare notes with what other states are doing with your own state. You see maybe your coverage is 80%. And here you see another local government and another state having a coverage of maybe it's 20%. You begin to ask yourself, if I'm having 20% and Z state is having 80%, what has he done that is making him to achieve that percentage coverage. So the peer learning, the study tours is going on owing to this innovation that has been brought by National Primary Health Agency.
The Executive Director and CEO, Dr. Faisal Shwaib, made it a point of duty to ensure that the organizational structure was reorganized to align with staff capabilities through the development of clear, fit-for-purpose roles and responsibilities. In addition, a human resource optimization initiative was launched to fully optimize the workforce through staff redistribution and capacity building.
He was now able to look at what we had. He had a choice of either letting people go or retraining them. And he chose to retrain staff, even the admin staff. And the result is that people we thought were just, in quotes, admin, and who we didn't think were technical, have now become quite technical and the pride of the agency.
I am a changed person, and my background is administration. I was in the admin and HR department. If not for Dr. Shaib and his programs and the foresight, it's not possible in so many organizations to move someone from administration to ICT. It's really, it's not an easy thing to do or a decision to take, but he has made us to be all-rounders. He has improved capacity, and he has made us to own the agency and the work that we do.
We have learned a lot of technology. Somebody like me before, outside simple word processing in computer and Excel, I didn't know much when it comes to the issue of infographics, especially to do with PowerPoint. But honestly now, I can do it. And in terms of exposure too, before it used to be only the leader going around for every program. But now I just came from another program, and it has been like that. So we have been allowed free hands, to really, work outside the primary healthcare system within the health sector. And I think that has given us a lot of exposure.
To ensure performance is tracked for effective performance optimization and reinforcement for increased job output, the performance management system of the agency was revised. The management also instituted a staff productivity award scheme to incentivize high performance, commitment, and loyalty of staff.
The end of year productivity award is a baby of this administration that is aimed at rewarding staff that excel to the year under review, so that any staff that is distinguished himself is being selected by the department and the zone, so that ED will now give them an award. This is aimed at encouraging them to put in the best, and the other staff that did not get the award will also compete, very healthy competition, so that the next year, so that they will also emerge as a winner of that award.
So one of the proud moments for me is a situation where we will identify the best performing staff, and then we will go back with this individual to their village. So we went back to their communities, to their villages, to say thank you to their relatives, to their community members, for producing such an individual that's making such a huge impact in the health sector, in primary health care, because we recognize that it takes a whole village to raise a child, not just the parents. So we will ask the community, what is it that NPHCDA can do for you within the remit of what was reasonable. And for some people, it was like, oh, can you help us renovate our primary healthcare center? Could you help us put a coat of fresh paint, or just a medical mission? So we're able to take these individuals back to their communities, and it made a huge and lasting impact in their psyche. So they'll come back to work even wanting to do more for the agency.
One very good part of that is the recognition. Hard work is recognized, and that serves as a motivation for the person that is recognized, and also other people everybody wants to be praised, everybody wants to be recognized. So I think it's unusual for public service, this kind of activity, but it's also, very, very valuable.
In terms of the games, we have 2 cups. If you can look them there. It's admin that always win. He himself play, we play, and we beat them twice. So all our staff are happy. They want that competition.
To ensure that all the changes that have been instituted at the agency and its operation is sustained beyond the current regime, Dr. Faisal Shwaib conceptualized the idea of the NPHCDA Leadership Development Academy to build staff capacity on core technical competencies and equip them with the necessary leadership and management skills.
There is a course that is designed, it's 6 months. We have in-class session twice, 3 weeks. Thereafter, they do external rotation. That's like internship. What we do is that we post them to some of our partners, some of our high-performing partners, to go and see, learn new culture of how to do things. They come back to in-class again. Then thereafter, we have some issues within the agency, like operational issues. We form them into syndicates. We give them those problems to go and solve real time and come back with solution. That's like capstone projects. The first cohort, we were able to take them out of the country to go and see how other country do what we are trying to say, that is not abstract. We have trained about 2 cohorts of about 137 officers that were not able to do so much. But after coming out of the school, it's about 6 months course. In fact, the transformation is very remarkable.
My experience as one of those who were fortunate to be there is something that I will describe as something I never had in my wildest dream. That I got it at a platter of gold, where I actually paid nothing to achieve so much. My own experience was like I found a different way. Like, it provided me with a medium to see how to do things differently, in the sense that we went to school, we were trained in school, but say the hands-on experience was actually seen in the LDA, because the approach that was used there was quite different from what I was used to. So it exposed me to a lot of things that both personally and then in the workplace, and gave me this this confidence, and then enhance my capacity to even see things differently from the way I used to see it. In all, I think it's a fantastic experience that I would wish almost everybody had that experience. It's a better experience than being told.
Improved staff morale and performance, as well as increased accountability and transparency, has led to a greatly enhanced perception of the agency.
There's a recognition not just nationally, but internationally as well. NPHCDA is now synonymous with hard work, with success, with being goal-driven, and with accountability. So that is, and I think in the past, when you say NPHCDA, it does not resonate, wow, what is NPHCDA? But it's becoming a household name.
The strong financial management process that has been established by the agency has restored the confidence of donors. This has led to the agency's ability to attract the return of the Global Alliance for Vaccine and Immunization, Gavi, to Nigeria. As a result, Gavi has recommenced direct funding to the federal government of Nigeria through the NPHCDA. Gavi has brought with it one of the largest investments into the PHC landscape of over $3 billion as a joint investment between it and the government of Nigeria. The joint investment with Gavi enabled the procurement and installation of over 12,000 cold chain equipments in one functional PHC facility in all the wards in 774 local government areas in the country. Also, the agency's deliberate establishment of initiatives that increased access, collaboration, and interaction with critical stakeholders are yielding great results, leading ultimately to greatly improved performance and enhanced quality of service delivery by the agency. It's the 6th year since the current management of the NPHCDA came on board, and a lot has been achieved. Without a doubt, the agency has a very impressive scorecard to show for all its efforts.
The NPHCDA, under the leadership of Dr. Faisal Sharp, has turned into a force for good with a lot of robust policies. It has also been very, very impactful in terms of drawing resources from the development world, from donors, from partners, and other non-governmental organizations. And those resources have also trickled down to the entire state through the various state primary care development agencies and board. So basically, they've served to cover a wide gap between what government could do at the subnational levels, and the national agency has tried to pull in resources to cover those gaps. Especially the impact is felt in many areas, particularly with the immunization program. The NPHCDA has done very excellently in terms of ensuring the availability of vaccines, and not just delivered to the state agency, but to the last mile, distribution across primary care facilities in the state.
The other big success that I would like to highlight is strengthening the systems. Really, the country is moving very strongly in that direction. It's not enough to do a single campaign. It's not enough to send one nurse or one midwife one day to give some drops of vaccination. We need to strengthen the system. And this is what NPHCDA is doing since last year with the PHC revitalization agenda, rallying all partners around, signing PHC MOUs with the states. So this is how PHC is going to be sustainable over the next few years. This is how PHC is going to deliver services to the citizens of Nigeria.
The agency is, however, not resting on its laurels. It is already looking to 2023 and beyond. NPHCDA aims to continue building on a sustainable health system, leveraging platforms established with support from partners to drive results as part of the 10-year strategy for transforming the primary healthcare space, 2021 to 2030.
We have laid out a very compelling vision for primary healthcare in our reimagining PHC agenda, making sure that we're working with all stakeholders to ensure that we achieve universal health coverage by 2030. That is huge, making sure that we're able to get Nigerians to a situation where they walk into a primary healthcare center and they get good quality healthcare. Saying that we're able to cater for the most vulnerable in our communities, that the elderly, the poor don't have to worry about out-of-pocket expenses. Those are things that we're working so assiduously to achieve, and they are possible because we're working with very bright minds. We're working with experts in the field to make sure that universal health coverage is not just lip service, that we will put our money where our mouth is, and that we will walk the talk.
More specifically, in 2023, the agency will push for the achievement of the following milestones. Transform up to an estimated 300 to 3,000 PHCs to Level 2 national standards, in line with the PHC re-imagining and 4-point agenda. Increase and improve quality of healthcare workers by facilitating recruiting and deploying over an additional 2,300 midwives. Vaccinate approximately 112 million eligible Nigerians with COVID-19 vaccines. Achieve equitable and increased coverage of traditional and new vaccines. There is no gainsaying the impact of the last 6 years at the NPHCDA under the leadership of Dr. Faisal Shwaib as Executive Director and CEO. For him, these are some of the critical factors responsible for this success.
It's got to be the environment, seeing how the directors in the agency, the program managers, the staff, have all aligned behind one vision to transform primary health care. Because of that belief, because of that dedication, we've seen that nothing is impossible. So we've seen ordinary people willing to do extraordinary things. That is why we find that all the barriers are just, falling by the wayside. We're overcoming them. And this translates all the way to the local government level.
The agency clearly has its job cut out for it. And as is evident, it is equal to the task, as it pushes to improve primary health care, increase routine immunization coverage, wipe out vaccine-derived polio from Nigeria, and introduce new cancer-preventing vaccines, amongst many other things. It is clear, Nigerians, its donors and partners are confident. It has both the capacity and ability to deliver on these promises.